How do students on SUNY Oswego's campus really feel about the health care provided here at Mary Walker Health Clinic? Chrissy LaMonica and Delilah Penna tell us their stories about some insecurities they have about Mary Walker Health Clinic.
Last semester I went to the Mary Walker Health Center and with a rash on my arm that I knew was an allergic reaction, so I asked them for antihistamine, saying that it was just a reaction and that it would go away. Yeah. And the lady proceeded to tell me that I had scabies and that I couldn't go to class the rest of the day, that I needed to go home and get checked because it's contagious, and that I should really be careful about myself. And then I told her, I was like, no, it's just an allergic reaction, it happens all the time. All I need is Benadryl. And she told me no, so I left or whatever, and I went to Kinney Drugs and I got Benadryl. And I took it, and about 2 hours later, it cleared. So I went back to the health center, and I told them, look, this is all I had. I just wanted to make sure that you knew. And they told me that they'd never seen me that day.
Mary Walker Health Clinic has been providing students with health care for some time now, and they do have a mission statement that explains students' rights. In that mission statement, it says, students deserve and can expect courteous reception and acceptance, expeditious and accurate diagnosis, prompt, effective, and humane treatment, and appropriate explanations of their health problems. However, Monica and Penna have stories that contradict that mission statement.
Well, last year I went to the health center because I developed an allergic reaction. I didn't know what it was, so I went over there, and the lady looked at me and she looked at my allergic reaction and she pulled out a book and she told me we were going to look through the book to find out what it was, and it made me feel really insecure because she didn't know what it was.
The symptoms of the flu and bacterial meningitis are very similar, so it's easy to do a misdiagnosis.
The reason why these two diseases are mentioned so often is because when one comes down with the flu, one is very, very, very sick with headache, dry cough, body aches, high fever, and when one comes down with bacterial meningitis, the same is true.
However, now Mary Walker Health Clinic is improving their screenings and diagnosis of students.
At our front desk, you may have noticed that we have a sign that says anyone who cannot get an appointment but has these symptoms, please tell us so that we can see you right away. And really what we're inching towards is it possible that you have something that is more than a cold, more than even possibly influenza.
Students at SUNY Oswego can rest assured Mary Walker Health Clinic is trying their best to provide reliable health care. Kayla Valvo, WTOP.